Welcome to the Medical Staff Voice Live. I'm Dr. Stan Frosweig, Chief Medical Officer at Community Memorial Health System, and I'm joined today by Dr. Stephan Sweet, orthopedic surgeon. Welcome, Dr. Sweet.
Thanks, Stan. Thanks for having me, and thanks to CMH for inviting me.
You're very welcome. Thank you. This is a great opportunity for our medical staff and community to learn more about you and your practice. In order to do so, we have a few questions that will enlighten us and give us better insight into your specialty. First of all, where do you come from? Where did you train? What brought you to Ventura?
Well, I was born and raised in Phoenix, Arizona, with a sister who's a neurosurgeon, so she was a smart one in the family. And I went to college in Atlanta at Emory University. I followed that up with graduate school in Philadelphia and New York. And then I went to medical school in DC at Georgetown University. And that's where I got interested in orthopedics. And I was also fortunate enough to meet my now wife at that time. She moved back to Los Angeles to help take care of her sick mother. And so I followed her out here for my residency at USC. In orthopedic surgery, and then my fellowship at UCLA in sports medicine. And naturally, I stayed, of course, to keep my wife happy in Southern California, which is a good thing. I've been very happy.
Yeah, happy wife?
Happy wife, happy life.
Thank you.
Absolutely.
I agree with you. You know, as orthopedics, as every specialty, has really become a subspecialty array of subspecialties. Now, I know you have special interests in orthopedics. I have had the luxury of working with you for many years now, but you're venturing in some very innovative orthopedic cutting edge work. Could you explain perhaps the Bear procedure, some of the robotic work that you've done, which I think much of the public and our colleagues would be interested in?
Sure. Thanks for asking about that, Stan. So I've been particularly interested in mainly shoulder and knee surgery. I do a full spectrum of surgery from arthroscopy of the shoulder and knee to joint replacements. But within that area, there's lots of advancements that are coming down the pipeline. And some of the exciting ones would be the Bear procedure, which you spoke about. That is basically a paradigm shift on how we've been treating ACLs, surgeries, that haven't really had any major changes over the last 40 years until now.
And if I may clarify, ACLs is an anterior cruciate ligament repair.
Of the knee, yes. So in the past, traditionally, when someone tears their ACL ligament in their knee, they get recurrent knee instability. They have trouble playing pivoting sports such as basketball, soccer, things of that nature. So to restore stability to the knee and get people back into the natural sports that they enjoy playing, we have to stabilize it. So traditionally we would take out the old torn ACL and replace it with another tendon from another part of the knee or from a cadaver, a donor ligament or tendon. And so by doing that, oftentimes you'll have pain and discomfort and weakness from wherever you take it from, such as the quadriceps or the patella tendon or the hamstrings. And we use that to replace ACL. Well, the Bear technique is a new technique now where instead of harvesting a donor tendon from another part of the knee, we regrow the ACL back to its natural origin. We take an implant that's made of type 1 collagen, and we interpose that between the stump of the ACL that tore and the bone where it was attached to, and we fill that implant up with the patient's own blood, and it creates a blood clot around the area to promote directional regrowth of the ACL, and it's had excellent results similar to the reconstruction where we replace the ACL, but we don't have the downside of pain and discomfort and weakness from the donor sites.
That's really impressive. I can hardly believe that because I remember way back when we would interpose not even tendons, but we would have material that we put as part of the ACL. So that's an incredible advancement. In addition to that, you've been doing some innovative robotic work with the knee replacements and so forth.
Right. I believe that using the ROSA robot for robotic assisted knee replacement has really enhanced the outcomes of my patients. In particular, when I do my knee replacements, I feel that the patients have been very pleased with the results, and allows me to feel more confident that I'm balancing the knee in a more accurate fashion. We're doing similar type of work with shoulder replacements now, navigation type techniques, smaller implants also for shoulders that are more bone preserving. And so there's a lot of advancements in multiple areas of the body, which is exciting.
It really is exciting. It really makes one think that medicine, and most importantly surgery, has become far more precision oriented, which of course is naturally going to lead to better outcomes.
Absolutely. All these new techniques and technology make me look good.
You know something, they're not accidental, so you will put a lot of work into updating your skills and your talents. Appreciate that. Do you treat all ages, or do you focus mainly on adults? What ages do you?
Actually, we do treat all ages, myself and the people in my practice. However, if they need specialty care from a pediatric orthopedic surgeon, of course we would refer them out in that direction. But we do operate and treat non-operatively all ages.
Thank you, that's excellent. Where's the practice located?
We have two offices. One is right across the street from CMH on Brent Street here in Ventura, and we've been there for almost 30 years, I believe. Not myself, but the group has been. It's called Ocean Orthopedics. And our other office we recently opened up in Camarillo on the corner of Lewis and Las Posas about a year ago.
Wow, excellent. Now, we have a fairly good understanding of your professional experience. How about your personal experience outside the office, your hobbies, your interests? Are you like a high diver or a mountain climber?
I wish I was more interested, but I would tell you that my main hobby is my family. I have my wife and my 7-year-old daughter, and that's my hobby, spending as much time as I can with them. We do everything together. There's a lot of travel. We exercise. I just love exposing my daughter to new things that she's never seen in the world before. She's interested in everything, and that's really, right now, my primary focus outside of work, of course.
Well, I respect that. It's probably the most admirable hobby anybody could have. The last portion that I enjoy immensely is the this or that portion. And basically what it is a stream of consciousness. There's no right answer or wrong answer. And it gives us a kind of an insight into the way you think. When you're on an airplane, do you prefer a window seat or an aisle seat, and why?
Definitely the aisle seat. That way I can stretch my legs and I can get up and go to the bathroom a lot easier.
Is your favorite day in the office or in the operating room?
That's a good question. I'm not sure if I have an answer because I like both. I think that's why I chose surgery as a specialty, because I'm splitting my time both in the OR and in the office. And so you can't really get too tired or bored with either one. It's a nice balance. So I don't have a really good answer, but I do have fun in both areas. I love interacting with people, hearing about their backgrounds and stories like you're doing today, asking me questions. But also when I see that there's something that I can fix and make their lives better, increase their quality of life, it's fun to be able to do that in the operating room. So,
that shows.
Yeah.
If you had not become a physician, did you have a backup plan?
I had another interest that I never pursued because I don't think I had the skills for it, but I would have loved to have been an architect.
Wow, I can understand that. My brother's an architect. If you had a choice between superpowers, would it be invisible or flying? Which would you choose?
Definitely flying.
Oh.
Yeah. I'm always a little bit late.
Oh, yeah.
So if I could fly, I'd get there a little quicker.
Yeah, I would second that. If you could compare yourself with any animal, which would it be and why?
Wow, that's a tough one.
It is.
I would say a chameleon. Have you had that answer yet?
No, but I like that answer.
Yeah, because I feel like I am always trying to adapt and modify myself to whatever the situation is and the environment, how it's always changing. And I don't feel like I'm stuck in neutral.
Wow. The only constant is change, huh?
Yes.
What is the best advice you would give your high school self? Study more, be careful driving, or perhaps something else?
I think I would have told myself to be a little bit more confident and could have asked the girl that I liked to go out with me.
Well, I think sounds like you've done quite well for yourself, so good for you.
Yeah.
When you were in medical school, did you have a favorite class?
I did enjoy doing the gross anatomy class. It's a very unique experience that you just really can't get anywhere else. And at first it was a little bit disturbing thinking about this poor person used to be walking the earth with a personality, but they were nice enough to donate their bodies for us to learn. And it was a very impressive opportunity to see all the structures of the body and how we've developed and how each joint and structure works. It was just it made quite an impression on me and really solidified my interest in medicine.
That's beautiful. When traveling in an automobile, would you rather be the driver or the passenger?
The driver. I like to be in control.
Spoken as a
I'm
true orthopedist.
A terrible side seat driver.
Card game or board game? What's your favorite game to play?
I would say we play so many games with my daughter now.
What's her favorite?
We play Uno. We play Monopoly. We play War. We play Old Maid. A lot of the old throwbacks. So I think that playing War with her. Oh no, I know what it is. It's blackjack. That's our favorite game.
Prepping her for Vegas. Good
Yes.
for you.
I'm sorry, not blackjack. Slapjack.
Slapjack.
Slapjack. I misspoke. I'm sorry. Slapjack, not blackjack.
What is the most interesting thing about you that we would not learn from your resume?
I don't know. I think my resume is pretty full.
Hey, good for
I'm
you.
trying to think of what's unique about me, but yes, I'm a former diehard fan of all Arizona sports teams, as I was born and raised there. But I've been in Los Angeles as long as I've been from Arizona, and I've learned that my Arizona teams lose every year.
So you become.
I'm transitioning to a Los Angeles fan. Yeah, I'm tired of failure every year. I want to root for a winner.
You know something that fits with your chameleon.
That's
approach.
right. I'm adapting.
Absolutely.
Adapting, yes.
Thank you for tuning in to learn more about Dr. Stephan Sweet. For more information on all the services and specialties offered at Community Memorial Health System, visit cmhshealth.org and be sure to like and subscribe for more from your community health system. Thank you, Dr. Sweet.
Thanks, Stan. Appreciate it.
My pleasure.